Hi there, I'm Chris, and I'm going to spend a few moments with you today to go over your annual benefits enrollment. This video will be brief and will only highlight your benefits. The full details on all of the benefits available to you and your family through Seminole County Public Schools are outlined in your Benefits and Enrollment Guide, as well as on the Employee Benefits website. The topics in this video follow along with the order of the topics in your guide. Okay, get out your pen and notepad or your tablet, and let's get started. What is annual enrollment? Well, it's the one time of year when you can make changes to your benefit elections. You can add or drop coverage in all of the plans available, not only for you, but also for your qualified dependents as well. The decisions you make now will go into effect January 1st, 2014, and will remain in effect until December 31st, 2014, unless you have a qualified event. Some examples of a qualified event are life changes like a marriage, divorce, death, having a baby, or loss or gain of other coverage. If you experience any of these events throughout the year, you only have 30 days from the date of the event to notify in writing the Employee Benefits Department. These are not automatic. You must take action to make the necessary changes. And remember, purchasing an individual policy does not constitute a qualified event. There are three main topics that I'm going to focus on today: your medical and dental options and the flexible spending accounts. I'll also be touching upon the other benefits available to you. First, let's start with a review of the medical insurance. We have a new medical carrier, Cigna. This change goes into effect January 1st, 2014, and the good news is that the board will continue to pay for the employee-only premium on all three plans that are offered. This is an annual amount of approximately $6,638 per employee per year, and a valuable benefit to you. So what does this change mean to you? Well, let me first assure you that the transition from United Healthcare to Cigna will be easy. There will still be three plans with Cigna from which you can choose: the Wellness Plan, the Standard Plan, and the Family Plan. These are the same plans that are currently in place with the same plan designs, deductibles, co-pays, and co-insurance, with the exception of the Standard and Family plans. The maximum out-of-pocket limits on these two plans have been reduced to meet the healthcare reform requirements. This is actually an added benefit if you choose to participate in either of these two plans. All three plans will continue to be open access with a nationwide network of physicians, hospitals, and labs. If you're currently undergoing treatment, expecting a baby, and have questions about transitioning your care, or just want to know if your doctor's in the network, Cigna has a toll-free number, 24 hours a day, 7 days a week, for you to get answers. Online resources will be available January 1st at mycigna.com. So, let's talk about medical rates. The health renewal was finalized at an average rate increase of 12% over the current rates. Employees who cover their dependents will see this impact in their payroll deductions. The payroll deduction for employee-only coverage remains zero for the 2014 plan year. As a reminder, these plans have co-payments for doctor visits, convenience care clinics, emergency rooms, and prescriptions. Remember to choose the appropriate care at the appropriate time. This will help you save money, get treated quickly, and save the plan money, which will in turn help keep the district's premiums affordable. If you are sick, try to see your doctor. If it's after hours or the weekend, try a convenience care clinic like the Minute Clinic before going to an urgent care center. And try to reserve the emergency room for true life-threatening situations. Another notable benefit on all three plans is that annual physicals and lab screenings continue to be covered at 100%. And with Cigna, you have the flexibility of both national labs, Quest and LabCorp. As you know by now, the district continues its focus on wellness, the significance of getting an annual physical and following your doctor's advice. It is important for you to see your doctor for an annual physical exam and to have the screenings that he or she recommends. When fighting any disease or sickness, early detection is the life-saving key that not only helps reduce the overall cost of your care, it can also reduce how invasive any treatment may be. Now, let's talk about how having your annual physical ties into your 2014 health plan options. If you have had an annual physical between September 16th of last year, 2012, through September 12th of this year, then you qualify for the Wellness Plan. The wellness plan has the lowest deductible of all three plans at $400. If you did not receive an annual physical by September 12th of this year, then you'll only have the choice of the standard plan, which has a $1,500 deductible, or the family plan, which has a $5,000 deductible. This also means you'll have to wait until next annual enrollment to qualify for the wellness plan. Verification of your wellness exam completion will happen in one of three easy ways. One, your provider files a wellness exam claim with United Healthcare as a result of your visit. Two, you're a new hire and you submitted a health certification form to Human Resources during the hiring process. Or three, you had the provider who performed your exam complete the wellness physical examination certification, and then you turned that form into the Employee Benefits Department before the deadline of September 12, 2013. As a reminder, CDL physicals do not qualify as a wellness exam. Now, let's take a few minutes to review how your policy covers newborns. As a reminder, you have 60 days from the day the baby's born to add them to your plan. Their coverage will always be effective as of their date of birth. If you enroll the baby within the first 30 days of birth, the additional premium for the baby is waived for the first 30 days. If you enroll the newborn between day 31 through 60, then you'll be responsible for all additional premiums from the date of birth. Once the baby is enrolled in your plan, you cannot drop their coverage until the next annual enrollment. Remember I mentioned earlier about qualifying events? Well, this is one of those life-changing events in which the IRS regulates when you can make changes to your elections outside of annual enrollment. If you want the baby to be covered under your spouse's plan, then you'll need to add the baby to his or her plan at the time of birth. Please note that the purchase of an individual plan does not constitute a qualified event. Cigna also has a healthy pregnancy program available to employees and covered dependents who are expecting. Starting January 1st, as soon as you find out you're pregnant, you can enroll in the Cigna Healthy Pregnancies, Healthy Babies program. This program is designed to help you and your baby stay healthy during your pregnancy and in the days and weeks following your baby's birth. Plus, you'll get rewarded for a good decision. When you participate and complete the program, you'll be eligible to receive a $150 rebate if you enroll by the end of your first trimester, or a $75 rebate if you enroll by the end of your second trimester. Just call the number on your Cigna ID card to enroll. And I know I've gone over these benefits very quickly, so please take a few moments to review your benefits and enrollment guide for all of the changes. Your prescription drug coverage will continue through Express Scripts. However, the way some drugs are covered is changing effective January 1st. When you select any of the medical plans offered, you're automatically enrolled in the prescription plan with Express Scripts. All three of the medical plans have the same prescription coverage. Remember that generic drugs will cost the least out of your pocket, so be sure to ask your doctor for generics when they're prescribing you a medication. Beginning January 1st, 2014, non-preferred medications will not be covered. Non-preferred medications are typically on the third-tier copayment. Typically, they're neither a generic nor a preferred brand drug. Exceptions to this may be made if your doctor has documented medical necessity for a non-preferred medication and it's on file via prior authorization with Express Scripts. In this case, you'll pay $60 at retail or $120 through mail order. So remember, after January 1st, it's even more important to ask for generics, as non-preferred medications will not be covered. Another change effective now impacts covered members who are managing diabetes. If you are a diabetic and require either refrigerated diabetes medications or testing supplies, you may now get them at your local retail store for up to a 90-day supply for the same mail order copay. This means that you no longer are required to use mail order if you'd like to pick up your prescriptions locally for insulin and other refrigerated medications used for the maintenance of diabetes. If you or any of your covered dependents take a maintenance medication to control conditions such as high cholesterol, high blood pressure, and even birth control, you must use the mail order feature of the plan. You're able to receive the first fill and 2 subsequent refills at the retail pharmacy for the retail copayment. After the third fill, you'll be responsible for the full cost of the prescription if you don't get it through the mail order. The mail order pharmacy saves you money. You can receive a 90-day supply of medication for the cost of 60 days. That's basically getting 30 days for free. If you are waiving the medical plans offered by the district because you have other coverage, You can receive a short-term disability benefit in lieu of the medical coverage. This plan is offered through Mutual of Omaha and pays a weekly benefit for up to 2 years. You must provide a copy of your ID card that shows you have coverage elsewhere to be enrolled in this plan. And again, it's at no cost to you. Wellness remains the focus of the district and continues to gain momentum. It's something that we all need to think about every day and not just at annual enrollment. When you think of wellness, think of little steps you can take instead of radically changing your life in a day. It's little everyday steps, your everyday choices that add up over time and make a big impact. You'll start to feel better, achieve more, and most importantly, maintain a healthy lifestyle. Cigna, in partnership with the district, is dedicated to improving the overall health of employees. There are many resources available to help you identify, target, achieve, and maintain your personal health goals. Throughout the year, you'll see various campaigns to engage in. The key is to make the decision to commit to change. Remember, you can do anything you put your mind to. Did you know that the district offers 2 flexible spending accounts to all eligible employees? A flexible spending account, or FSA, allows you to set aside money on a pre-tax basis to pay for qualified medical and dependent daycare expenses. There are 2 types of FSAs offered by the district, a medical FSA and a dependent daycare FSA. Both are administered by mycafeteriaplan.com. You're able to submit claims via mail, fax, email, or you can upload them to their secure website. The medical FSA is for medical, dental, and vision expenses, not only for you, but also for any of your qualified dependents. And the dependents don't have to be enrolled in the district's health plan for you to get their expenses reimbursed. There's a debit card for the medical FSA. If you choose to use the debit card, be aware that you must provide supporting documentation upon request, or by law, your card must be deactivated. Failure to provide the requested receipts may result in an additional payroll deduction to recoup the claim. Please make note that these flexible spending accounts are governed by the IRS. Therefore, it's important for you to keep all of your receipts with your tax information. So you may be asking, how does a medical flexible spending account work? Well, first, you must estimate the amount of out-of-pocket medical expenses you feel you may incur in the upcoming year. This amount will be your election amount, and your account will be funded with your election amount on day 1 of the plan year. Your election amount is divided by the frequency of pay periods, and that amount is then deducted from your paycheck each pay period on a pre-tax basis. You'll receive a debit card for the medical FSA, which is the most convenient way to receive reimbursement. Simply swipe your debit card at your provider's office, pharmacy, the hospital, and so on at the time of service, and your claim will be paid instantly. It is important when you're utilizing the debit card to still ask for and keep an itemized receipt on file. You may still receive a letter from My Cafeteria Plan requesting this receipt for IRS documentation purposes. Even if you use the debit card, you are ultimately responsible to the IRS for documentation. You're required to keep it and submit it, so the plan is compliant with government regulations. The Dependent Care FSA is for dependent care expenses only. So daycare, after-school care, and summer camps for children under the age of 13 are eligible expenses. This account cannot be used for medical expenses and does not come with a debit card. You will have to file your claims via fax, mail, or uploading them to mycafeteriaplan.com's secure website. So how much can you contribute annually to the FSA plan? Well, for the medical flexible spending, you can contribute a minimum of $250 per year and a maximum of $2,500. Funds in this FSA are available January 1st. For the dependent care flexible spending, the maximum amount is $5,000 per household. Funds in this FSA are available as they're deducted out of your paycheck. Section 125 flexible spending plans are governed by the use it or lose it rule, which means any amount remaining at the end of the year is forfeited due to IRS regulations. All claims must be submitted no later than 90 days after the end of the plan year. You will continue to have 3 dental plans from which to choose. There are two PPO plans and the new prepaid 225 plan that will replace the current Heritage DHMO plan. All three plans are offered by Assurant. The PPO plans give you the freedom to go in or out of network to a dentist, and there's a larger number of in-network providers available to you. Providers within Assurant's network have agreed to their reimbursement amounts. Providers outside of the network have not. So keep in mind, if you go out of network for services, you run the risk of being balance billed between what your dentist charges and what Assurant reimburses. The payroll deductions for the PPO plans will remain unchanged and can be found in your Benefits and Enrollment Guide. The new prepaid 225 plan has in-network benefits only and has a smaller network of providers compared to the PPO network. It does not offer any out-of-network benefits. Like the Heritage plan, you must select a primary dentist. Services that are covered under this plan have copays, and there is no plan year maximum. In most instances, the copays under the 225 plan are lower than the current Heritage copays. The greatest benefit under this new plan is that orthodontia is now a covered benefit for children and adults. If you're currently enrolled in the Heritage plan and would like to enroll in the 225 plan, you must take action. During annual enrollment, you'll need to select this plan along with a dentist on the ESS site. If you do not choose a dentist, one will be assigned to you. The board will continue to provide all benefit-eligible employees with 1 times your annual salary in life insurance. You're also able to purchase additional life insurance for yourself as well as any eligible dependents. Additional voluntary life insurance can be bought in $10,000 increments up to 4 times your annual salary. If you did not purchase voluntary life insurance in the past or want to increase your current amount, you will have to provide evidence of insurability, which means you'll have to answer medical questions that an underwriter will then use to determine your eligibility for coverage. If you have at least $60,000 of additional life insurance, you're able to purchase life insurance for your spouse in $10,000 increments up to $150,000, but not to exceed 50% of the combined value of your board-paid and supplemental life insurance amounts. For children, you have 3 benefit options available: $2,000, $5,000, or $10,000 per child. Remember, these are just the highlights, so please be sure to review your Benefits and Enrollment Guide or the Employee Benefits website for more information. Your current vision plan is not changing. This plan is available to employees and their eligible dependents who wear glasses or contacts. You have a vision exam that's covered under your medical plan. Basically, you can get your eyes examined every year for your primary care copayment. Your medical plan does not cover glasses or contacts. The voluntary vision plan through United Healthcare Vision, formerly Spectera, gives you coverage for hardware. So think of it this way: if you need glasses or contacts to see better, then the voluntary vision plan gives you coverage for this hardware. Keep in mind that replacement lenses and frames are covered every 24 months. If you have good vision and don't need contacts or glasses to help you see, then the medical plan will allow you to get your eyes checked every 12 months to ensure your eyes stay healthy. I want you to think for just a moment, what would happen if you were unable to work for an extended period of time? Do you have enough money in savings to pay for your everyday expenses, like your mortgage or rent, your grocery bill, utility bills? Chances are you're like most Americans who don't. Well, did you know that there is an inexpensive way to buy insurance for your paycheck? It's disability insurance. And the district offers both long-term and short-term disability coverage through Cigna. After your medical insurance, long-term disability is one of the most important coverages you can purchase to protect your financial health. It will pay you 60% of your monthly earnings until you turn age 65 if you're completely and totally disabled. At a cost of only $10.95 a month, it's a steal. You also have a short-term disability plan available to you. This plan will pay you a weekly benefit if you're medically unable to work for an extended period of time. You can purchase up to 60% of your weekly earnings in $100 increments up to $820. Please see your Benefits and Enrollment Guide for more details of these valuable plans. If you are a returning employee, you'll need to verify your coverage or make your desired changes during annual enrollment via the ESS website. Annual enrollment will be from October 1st through October 14th. You may ask yourself, what do I need to do if I've met the physical requirement and don't want to make any other changes? Well, this is your once-a-year opportunity to review your benefits, and you should sign into the ESS site and verify your coverages. Each year, the IRS requires that you re-enroll in your flexible spending accounts. And don't forget to hit the submit button when you're done. If you're a new employee and hired after September 3rd, you will have to complete a paper enrollment form that you received at your new employee orientation. These forms are due to the Employee Benefits Department located on the first floor of the Educational Support Center no later than 30 days from your date of hire. If you have questions, you can contact the Employee Benefits Department either by phone, email, or in person. The team is there Monday through Friday from 8 a.m. to 4:30 p.m. Okay, so I know we went over a lot of information today. Just remember, there are more details in your benefits and enrollment guide, as well as online at the Employee Benefits website. You'll also be able to view this video again on the website. So here's a checklist of your homework. 1. Annual enrollment is from October 1st through the 14th. 2. Sign on to the ESS site to review and make changes. Remember to hit that submit button. And 3. Present your new Cigna ID card to your providers after January 1st. To recap, your elections will go into effect January 1st, 2014. Your current medical card stays in effect until December 31st. New Cigna medical card distribution will begin in December. It's all about education and engagement. Educate yourself about your benefits and engage in a healthy lifestyle. Seminole County Public Schools is an exceptional organization because of all of you.